So, as we think about how this system works, the professions that focus on body structure, chiropractic, massage, physical therapy, orthopedic, sports medicine, orthopedic doctors, all of them are focused on biomechanics, body structure, posture, etc. Sometimes, in order to resolve a problem in the structural area of the system, we have to address body chemistry. And sometimes, in order to resolve patterns of imbalance here, we have to resolve emotional issues that are helping to create that pattern of tension. So the solution to structural problems is not always a biomechanical type of treatment. Sometimes the treatment is going to require a biochemical intervention, sometimes psychological or spiritual. If the focus is on organ health, sometimes the key to resolving an organic problem is, again, resolving an emotional issue. It may be nutrition, it may be drugs, it may be herbs, it may be getting rid of toxins from the system, it may be dealing with food allergies. And sometimes the solution to an organic problem is getting the body structure balanced, and that's going to affect the system and help that area. So if you look at it this way, we can understand that all the professions are needed, all the professions are interdependent, just like all the parts of the mind and body, and that the solutions to problems in any area may come from an unlikely area that you wouldn't necessarily predict at first because you think that it's simply a structural problem. Another thing that this points out is that illness care is going to help a lot. It's going to save lives. It's going to make a tremendous difference in people's well-being. But illness care is what happens toward the end of the process, and when the system is balanced, there's no illness. As the system goes out of balance, it's possible to intervene and get the system back into balance, but drugs and surgery won't do that. When the system is more imbalanced, then drugs and surgery may be more appropriate and more helpful. This is when we get to the point where we need radical treatment that's more expensive. This is going to drive up the cost of health care. If we intervene at an earlier stage of the process, when the person is just beginning to get out of balance, that's going to prevent the more costly care. It's going to prevent more profound illnesses and keep people in balance. That's going to be the solution to the healthcare costs long term. It's keeping people healthy by doing conservative interventions that focus on keeping people in balance. That will solve the healthcare cost crisis and the economic crisis if we generate a healthier population. So we need modern Western medicine, and we need complementary and alternative medicine. We also need Eastern and Western approaches. This model, while it's explained clearly in Western terms, is also basically a summary of Eastern philosophy of medicine, Eastern theory on healthcare. So this model is going to be the underlying principles that you'll see over and over again throughout the course. You won't see this particular chart again, but you'll be hearing these principles over and over again throughout the course. So I hope that was helpful and enjoyable, and we'll look forward to having you in the program.